I recently had a friend reach out to me to ask about weaning off of her GLP medication, and I thought I would record my answer to her and share it with you all because this is one of the most frequently asked questions that I get when we're thinking about GLP medications. So this friend has been on a GLP medication for a couple of years. She initially started after having a baby and wanted to help lose baby weight a little bit faster, but even before getting pregnant, she had been working on her weight and trying to work on her weight loss goals. So she started the GLP medication. She's been on it the last couple of years. She recently stopped cold turkey and realized that was maybe not ideal, had some weight gain, feeling that she was a lot more hungry, so went back on the medication. But she's like, you know what, I really don't want to take this medication long term. So what are the things that I can do and have in place in order to try to wean off the medication? So what I will say is that generally we think of these medications as long-term options. There's a very small subset of people, though, who may do okay actually with short or intermediate term use of this medication. Now, that's definitely not great medical advice for just anybody who's listening, but if you fall into this situation, if you want to sort of pay attention to how your body's responding, it may be reasonable to consider what does long-term use look like with these medications? And I believe very strongly you're the boss of your body. So if you want to stop, of course you can stop. It's also completely safe to stop these medications abruptly. So let's say you become pregnant, maybe you have a severe side effect to the medication. If you need or want to stop the medication abruptly, that is absolutely okay to do, but you'll likely notice weight gain and food cravings come back. So all of that being said, if you're thinking, hey, I want to try to wean off the medication, what are the things that I need to have in place? So for one, I would be at my goal weight before making this decision or thinking about weaning off the medication. So once you're at that place, you want to be thinking about what your day-to-day habits look like. Are your routines in line with your health goals? Are you eating, 1, 2, 3 meals per day? Do you find that you have gotten those into windows that really make sense for your schedule? Are you emphasizing protein in the diet, emphasizing fiber in the diet? Are you sleeping well? Is your stress managed? Are you moving your body plenty, both with resistance training as well as walking? All of these things will be really important. So making sure that you have those in place. Then you can think about stepping back on your medication dose and or spacing out the timing of medication. It will depend a little bit about which medication that you're on, but generally I may have people, instead of taking a weekly dose of medication, let's see, what does it feel like to take it every 10 days, for example? How is that feeling in your body? Is your weight stable? Are you able to, feel okay throughout the duration? If so, great. You might also then consider stepping back a dose. So let's say you're on a top dose of medication. What does it look like to step back to the next dose of medication? And then repeat this process slowly over the course of many, many months, likely, where you're spacing out dosing. Hey, how's that feeling in my body? Then decreasing to a lower dose of medication. And then from there, you can continue to take these slow stepwards down. Now, again, I'm not speaking to just everybody. Generally, these are designed as long-term use medications, but if you really desire to stop, this is how I would try to support a patient in doing that. What most frequently happens is that someone may do well on a lower dose of medication. We might consider other medications. So do they need something as potent as a GLP medication versus can they get away with something like metformin and bupropion? Metformin being a medication traditionally thought of for the treatment of type 2 diabetes, but maybe certainly used for insulin resistance. Bupropion, a medication used for depression, but very effective from a craving standpoint. So sometimes we can even transition to other medications, even if we're just thinking about from a cost perspective. If someone's paying out of pocket, long-term GLP use may not be in line with their goals. They may be looking for something more cost effective. So a lot of different things that we can consider. Certainly, I would recommend to do this under the guidance of a board-certified obesity medicine physician. You can find one at the ABOM, the American Board of Obesity Medicine. I see patients in Charlottesville, Virginia, and in telemedicine throughout the states of Illinois, Tennessee, and Virginia. Follow me for more.